Depression is a common and serious mental disorder affecting many people's lives. This video will explore the major causes of depression and other factors that significantly increase the risk. Without further ado, let's start. What are the basic facts of depression? More than 250 million people worldwide live with some form of depression. Everyone will feel sad or depressed at some point during their life. It is a natural reaction to situations that cause emotional upset or pain. Most of the time, these feelings are temporary and will fade away. However, suppose you have a low mood, low self-esteem, and loss of interest or pleasure in normally enjoyable activities. And if these symptoms last more than 2 weeks, you might have depression. It is a mental disorder, also known as Major Depressive Disorder, in medical terms. There are 6 subtypes of depression. Melancholic depression is a loss of pleasure in most activities and a lack of response to pleasurable stimulation. Atypical depression shows significant weight gain, excessive sleep or sleepiness, overly sensitivity to interpersonal rejection. Catatonic depression is a rare and severe form of major depression. The person is mute and extremely slow. Sometimes, the person can remain immobile or exhibit bizarre movements. Depression with anxious distress generally refers to bipolar disorder. The person has extreme mood swings between depression and mania. Peripartum depression is depression experienced by women after giving birth or during pregnancy. Seasonal affective disorder is depression that happens in the autumn or winter but resolves in spring. There are 6 major causes of depression. 1. Biopsychosocial model. This model proposes that biological, psychological, and social factors all play a role in causing depression. When a person has a pre-existing vulnerability, a stressful life event can trigger depression. Genes, hormones, and brain chemicals may decide how vulnerable a person is. Psychiatrist Aaron Beck suggested that these people tend to negatively respond to the self, the environment, and the future. He used the negative cognitive triad model to describe the typical thinking of a depressed person. I am defective or inadequate. All of my experiences result in defeats or failures. The future is hopeless. The mind of a depressed person slips away in the downward spiral of this automatic negative response. In addition to the psychological tendency, childhood abuse, neglect, and family dysfunction significantly increase the risk of major depression. 2. Genetics. Most psychiatric disorders have a genetic background. Depression is no exception. Children, siblings, and parents of people with severe depression are more likely to have depression than the general population. Studies have identified multiple genes linked to the risk of major depression. However, there is no single depression gene that is responsible. Instead, depression is the result of many factors. 3. Chronic disease. Chronic or terminal diseases can cause secondary depression. Some examples are diabetes, heart disease, arthritis, kidney disease, HIV and AIDS, lupus, and multiple sclerosis. Hypothyroidism may also lead to depressed feelings. 4. Depression by medical treatment. Some therapies and drugs can cause depression. They include interferons, beta blockers, acne drug isotretinoin, contraceptives, cardiac agents, anticonvulsants, anti-migraine drugs, antipsychotics, and hormonal agents. 5. Substance misuse. Nearly 30% of people with substance misuse problems also have depression. Drugs or alcohol may give you a short relief, but will make the depression worse in the long run. 6. Vitamin deficiency. Vitamin B2, B6, B12, and folate deficiency may cause depression. Vitamin deficiency results from eating a poor diet or not being able to absorb the vitamins you consume. Older adults, vegetarians, and people with digestive disorders such as celiac disease or Crohn's disease are higher risk. There are other factors that may increase the risk of depression. Certain personality traits. People who are low self-esteem and overly self-critical or pessimistic have more chance of getting depression. Traumatic or stressful events. The loss of a loved one, a difficult relationship, or financial problems increase the risk. Gender identity. Being lesbian, gay, bisexual, transgender or intersex in an unsupportive environment increases the risk. For example, transgender people have a 4 times higher chance than cisgender people to get depression. History of mental health disorders. Depression often coexists with other mental problems, such as anxiety, eating, or post-traumatic stress disorder. Abuse. Physical, sexual, or emotional abuse can make you more vulnerable to depression later in life. Gender. Women are about twice as likely to become depressed. A quick reminder, this video is for information only. Please seek medical advice from appropriate healthcare professionals. If you like the video, give it a thumbs up and share it with your friends. Comment below to share your understanding of depression. Please subscribe to our channel. Your support means everything to me.